Today we will be talking about the U.S. healthcare system versus the Japanese healthcare system, and we will point out the major differences between the two. Next. The United States uses a combination of private insurance plans and state programs. The private insurance companies are chosen by the individual most of the time, such as Blue Cross or Blue Shield. Those are both privately owned companies. States in the U.S. have different programs such as Medicaid and their own Medicare programs with different rules based on the state. The United States, as we know, has the most expensive healthcare system in the world. Next. Some of the strengths of the U.S. healthcare system is that we do have high quality care. We have some of the best doctors and nurses in the world. We have great clinical research programs and trials. Our technology and our equipment is usually always up to date, and we do have many specialties to choose from other than the typical doctor, nurse. We have many options. Next. Some of the weaknesses of the U.S. healthcare system is that the individual cost per person are usually more on the pricey side. Not everyone is insured, so sometimes that leads to patients paying for their procedures out of pocket. And better coverage gets better care, so if you pay more for an insurance policy, then you may get better care over someone who's paying for a lesser policy. Next. The cost of U.S. healthcare, on average, in 2021, we actually spent around $4.3 trillion just on healthcare alone. And that averages to be about $12,900 per person. And in the U.S., some states do have lower spending, about $6,000 per person. Next. What could be changed about the U.S. healthcare system? Reducing drug prices, and we could focus on improving health by finding the causes through extensive research. There are some health problems that we actually don't know much about because we haven't spent the time to research them. We could improve doctor-patient visits by prioritizing the goals of the patient first and then going from there. Next. The U.S. healthcare system in a nutshell. The U.S. does not offer universal coverage, as we know, and so that leaves most and many Americans with small coverage or none at all. So that means that if you have no coverage, you're paying for your doctor visits, procedures, all out of pocket. Americans are overpaying for policies that they sometimes won't even use. If you pay for a dental plan and you only go to the dentist maybe once every 3 years, then you're sometimes paying for more than what you don't even need. Next. What could be next for U.S. healthcare? If changes don't happen over the next few years, the rates of insurance will go up, and that means that spending will increase. I know that over the next 5 to 6 years, if we don't make changes to the U.S. healthcare system, then we could be spending 12.4% more on healthcare than we are now. Next. So let's talk about Japan now. Japan has a universal healthcare system using a combination of employment plans and some government funding to help cover the rest. Over 50% of the population is covered by their employers. Japan offers certain plans for the non-employed individuals and also the poor people as well. The elderly has specific plans that are set just for them to give them the best quality care that they can use. And I wanted to point back at the non-employed individuals. Sometimes if a person is impaired or disabled, then the government assistance is solely what they can rely on because they're not able to go to work. So that's why the government actually has to step in to help most times. Next. Some of the strengths of the Japanese healthcare system is that they also have high quality care just like us. Their plans are very affordable and they have low cost procedures, but it's very rare for a patient to pay out of pocket. If a patient were to pay out of pocket, it would be for like an extra service, like a spa treatment, acupuncture, something like that. An average hospital stay in Japan in US dollars would be around $10 or $20. And that's for an entire family room. Next. Some of the weaknesses in Japan's healthcare system is that there is a huge shortage of doctors and nurses. They actually have a smaller ratio to the United States because their hospitals are privately owned, and so is their doctor's offices, and they are non-profit. A typical doctor visit in the Japanese world is 3 to 5 minutes. Shorter visit times could lead to possible misdiagnosis. They also have lower quality equipment, and sometimes it's hard for them to be able to find the funding to replace the equipment, so that could also lead to false readings as well. Next. The cost of Japanese healthcare, on average, they spend about $380 billion, and that usually averages out to about $3,300 per person, which is still way cheaper than the US. The good thing about Japan is that every procedure has a set price. Even a doctor visit has a set price. So if a patient wanted to go in for a hand accident and they needed to have 50 stitches, maybe Japan has a set rate per stitch, and that may be like $1, let's say. Medication is also very, very reasonable in Japan. I know that there is a medication in the US that could be between $300 and $400, but in Japan it would be around $20 or $30. Next. What could be changed to improve the Japanese healthcare system? We could advance the medical equipment and spend, more money to make sure that there are quality products. Also, something in Japan that we mentioned in the last slide was that the doctor visits are actually so short. They range between 3 and 5 minutes. So the patient and doctor relationships, there really is none. So then they could have better conversations. They could get down to the patient's goals, and then that would improve the overall care. The last thing is that Japan doesn't have that many good research programs. So 9 times out of 10, they're not spending enough money to research on certain medications or certain problems. Next. Sorry. The Japanese healthcare system in a nutshell is Japan offers universal coverage for all of their citizens. Every citizen in Japan is covered by healthcare, so they will never have to worry about paying for their own health insurance. The coverage is usually through their employer, but it is sometimes paid for by the government, like we talked about. The elderly has their own set programs, and as well as the lower income families as well. The people of Japan do not pay any medical bills because they rely solely on their insurance to cover those things. Next. What could be next for Japanese healthcare? Japan will most likely always have universal healthcare unless something were to happen, bankruptcy, things like that. Japan has a very cost-effective system, and overall it is succeeding, but there are definitely some things that can be improved upon, just like in the US. Next. And references.